Another question that I have is dealing with the whole Bayou Health legacy Medicaid issue. Let's say, hypothetically, again, I'm just speaking hypothetically. Let's say that you got a Bayou Health plan that fits in 2 clinics here, but that child also needs to see another doctor that's not in a Bayou Health plan. Where does that child get taken care of? Because it's not legacy Medicaid, it is Bayou Health, and the parents can't afford Blue Cross Blue Shield or some other private care. If the child, and my understanding is that y'all said that children will not go without care. Where is that child going to go to get care for that specific need?
You want to take that one together?
Yeah.
Because that's a little bit
outside of our scope.
program.
Right. So remember, Bayou Health is a Medicaid managed care product, and so using the example that you gave, if your child had one Bayou Health plan,
Right.
where they were able to be seen by a physician outside of this clinic, the CSHS clinics that we run across the state take all the plans, so that wouldn't be an issue. The issue that may come up is that if your child is no longer being seen in one of the CSHS clinics, so now has to choose a Bayou Health plan, but still has 2 or 3 subspecialists to see, all of those subspecialists may not take the same Bayou Health plan. So, if you have a Bayou Health plan and 2 of the doctors you need to see take it, but the 3rd one doesn't, then it's incumbent upon that Bayou Health plan to either find you a specialist, it's their requirement to find you a specialist that takes their Bayou Health plan, or they can go outside of those plans.
And Bayou Health understands this.
Right, they can go
Because
outside of their
I've heard
plans.
totally different. Also, my understanding and having talked to Medicaid personally, legacy Medicaid is an option. Legacy Medicaid is definitely an option.
Yeah, it's an option for all of our patients right now by the sheer nature, as Dr. Berry said, that you're a CSHS patient. So as a CSHS patient, when Bayou Health was formed, there were what we call carve-outs, right? So groups that didn't have to select a Bayou Health plan. So if you went to at least one CSHS clinic, then you could select legacy Medicaid, as you said, or if you had a Medicaid waiver.
Right.
Our concern is what we're sharing with you is that if you are a parent of a child who is one of your CSHS clinics is closing and that's your only CSHS clinic, then you no longer can opt out of Bayou Health. We have shared that as a program with Medicaid and saying, because those are Medicaid rules, and saying that is something that will cause a change in being able to select providers, because no longer can that parent
So
opt out.
someone is currently getting Bayou Health Medicaid, and medically, they really don't need to be on Bayou Health. They're stuck. They can't go back to that legacy Medicaid that was working before they were.
Right. If you don't have a waiver or are not being seen in a CSHS clinic, then you will have to choose a Bayou Health plan by the current Bayou Health rules. It's not, you can't choose Medicaid.
If you're on the waiting list.
The waiting list.
On the waiting list also, you can, okay, the waiting list lets you choose
Waiver
legacy
list
as well.
is optional.
And the thing is like, I'm not the only one, because when I call the doctors that they give us, all those doctors that we don't take Medicaid, we don't take this, I mean, it's just constant. I mean, no matter where you go, they don't take it. So what the person is gonna have Medicaid when it don't work? It don't work.
So the good thing about the closure, the 10 places where we're proposing to close. The good thing about the 10 places that we're proposing to close is that we didn't just select those folks off the web. Dr. Berry had to call those doctors and say, will you take our patients? Because we are well aware of this issue. So we know that just because somebody puts Medicaid on their website or Bayou Health, they won't take them.
They put on there, they say, well, I'm sorry, we was added to the list on mistake.
All right.
And
even if a doctor accepts Medicaid in general or accepts all the Bayou Health plans, they still have a choice, right, if they want to accept somebody. So we have to make sure, as Dr. Berry said, that if we're going to transition, that there's actually a transition to a physician, right? So each of those folks has accepted that they would be willing to accept our patients, that we'll be able to transition, because otherwise we don't have anywhere to transition, which is why there are 23 clinics that are not closing.